Hello everybody, this is Dan Talion. I'm reporting in from Pittsburgh, Pennsylvania. I'm currently at my externship site at the University of Pittsburgh Medical Center. And for this week's case presentation, I will be talking about a patient that I saw, and we suspect that she has a case of auditory neuropathy spectrum disorder. Okay, so here's some case history on this patient. ET is a 34-year-old female who has a history of bilateral sensory neural hearing loss. She didn't give us a date as to when that hearing loss started, but from what we can gather, it was with her for pretty much her entire life. She reports having problems understanding conversational speech, but states that this doesn't seem to be from inadequate volume. She reports that she just can't understand the speech when she's hearing people talk, and she also has significant difficulty with understanding speech in background noise. In addition to that, she also heavily relies on lip reading due to that difficulty of understanding speech. For ET, her native language actually isn't English. However, she does report that she has the same problem when speaking to her mother, who speaks in her native language. She doesn't report any cause of this hearing loss, and she also denies any sudden changes in her hearing. Here's a copy of ET's audiogram. So we see a sensory neural hearing loss that is in the range of moderate, upward sloping to within normal limits, or a mild sensory neural hearing loss. This audiogram was done in early May of 2016. It's also important to note that the audiology department was not the primary ones in charge of ET's care. She was actually first seen by the ENT department, which is just one floor below us. Her SRT and PTA are in good agreement. Her word recognition scores are actually disproportionately low when you look at the sprint chart. And in the right ear they were 24%, in the left ear they were 30%. So that's really pretty low when we look at the results of this audiogram. It is important to note that the reliability was judged to be fair by the audiologist who did this testing. So the day that I saw this patient was actually in early June. She was referred up to the audiology department for ABR and DPOAEs about a month after she saw the ENT group downstairs and had that audio that I just showed you. So the results of the ABR, no observable waveforms for stimuli at both 70 and 90 dB. They were completed in rarefaction and condensation. The cochlear microphonics, while small, appear to reflect stimulus phase at 90 dB bilaterally. So what we see there is really just not much of a result on the ABR and no discernible waveforms. Not what we would expect for a otherwise healthy 34-year-old female. When we looked at the DPOAEs, they were all present and very robust for frequencies 1,000 to 8,000 hertz in both ears. So some pretty interesting results here, and also some pretty classic results for ANSD. A little bit of a summary here just to wrap the current results that I presented together, and kind of where we left off with this patient. So I really only saw the patient for the ABR and the DPOAEs. She was seeking treatment from the ENT team downstairs, like I said. After reading the report from the ENTs, they discussed the results with ET, and she was very excited that she actually had some confirmation as to what might be causing her hearing difficulties. And so she was very pleased with the work that we had done, the diagnostics that we did. However, the ENT team didn't have any recommendations for her. Looking through the chart, they really were only able to say that they would look into some current literature on cochlear implants and how cochlear implants might benefit the patient population with ANSD. As far as the literature goes, I haven't been able to find too much on cochlear implants in patients, adult patients who have already learned language and who also have ANSD. I did find an article by G et al. 2014, which discusses the outcomes of patients with ANSD who have received cochlear implants. They pretty much report that it's a bit of a guess. It's very hard to determine post-implant which patient would benefit from a CI and which patient wouldn't. They reported mixed results in the outcomes of the patients, and their rationale behind what might be causing those mixed results would be that depending on where the ANSD is originating from in the auditory system. As far as I know, and as far as what they said in the article, they really haven't come up with a good way to measure the outcome or propose an outcome before the CI surgery. So the cost to benefit ratio for a cochlear implant surgery is definitely thrown into question there, and the patient really has to make sure that it's something that they want to do and also something that they feel might help them. There's is some research that I have seen for prelingual children that show promising outcomes with cochlear implants. However, I believe those results are still rather mixed, and they're still not entirely sure how to predict who and who won't benefit from a cochlear implant. So here's a couple of good discussion questions for you guys. Have any of you seen a case of ANSD in the clinic? If so, what were some of the recommendations for a proposed treatment plan? And then if you haven't seen a case of ANSD in the clinic, what would you suggest for ET? She's a 34-year-old female, otherwise healthy, and has been dealing with this problem for most of her life. So I kind of wonder what else you guys would recommend, and what do you guys think about this? This is the reference that I used for my article. Take a look at it if you're interested. If not, I hope y'all having a good internship, and pretty soon y'all are going to be moving on to externship. So best of luck, and yeah, take care.